and just make sure everything's prep, basically.
Yeah, that's probably mess up on.
Well, depends if you already have a primary line running.
Oh, you prime the primary, and then you don't prime the secondary. Right?
You do.
Secondary.
Yeah.
Back prime with.
Okay, so with all these terms, priming is probably where we'll start off, obviously. So we can either have a TKO, which would be maybe like a small, 500. This is 500, right? It doesn't, oh, it's 250. Sorry. This might be like just a TKO or a flush after a patient's getting an antibiotic as their primary, or the patient could be running fluid in a much bigger bag than this, or it might be a 500 ml. They might run a 1,000, big bag over there.
Just good.
And then at that point, it's not even. If you need to piggyback a medication, then you'll get your secondary tubing and you'll go from there. But if the doctor says that this patient is having an infection, they have, what's the one that starts with pneumonia? Sorry. I was getting ready to say, I've taken care of so many pneumonia patients. The patient has pneumonia. What assessment are you going to do for this patient?
Respiratory lung assessment.
What else could you check? Okay, that's really important. Why is white blood cell like the most important? And when I compare my baseline, patient has a white blood cell count of like, let's say like 16,000, and then and then I come back, it's a couple hours later and it's still way up there, then I might need to ask the doctor to change the antibiotic or increase it, right?
Yeah.
So the baseline assessments are always really important. As far as IV piggyback, some of the medications you're going to be giving piggybacks are most likely the antibiotics. And then, do you guys know anything else?
There was some powder form that was like, it goes in a
Protonics can be piggybacked too.
Okay, maybe that's.
Protonics,
Potassium chloride.
potassium chloride, exactly. And then anything else?
They've done thing. No, yeah, they do albumin, but the one that I did was
Albumin is actually going to be your primary. Because albumin, you're going to assume that this patient has some type of issue with their blood pressure, and they need this medication like right away.
yeah, clotting factors.
Yeah.
Yeah, they do.
Mainly what you're going to see in the hospital is the antibiotics, which are simple because labs, as far as checking their white blood cell count and doing your own assessment, it's not that bad. What's the main thing you want to check though if you're giving an antibiotic? Allergies is so important. If the patient you come in, you say, "Hi, my name is Kaara, I'm going to be your nurse today." I just like to verify that this is you. Can you have you state your first and last name? They state their first and last name. You say, "I don't see that you have an allergy band. Could you tell me, do you know if you have any history of allergies?" The patient says, "I have an allergy to cefazolin," and they don't have a band on. That's a mental note to go back and create an allergy band for that. But if the medication is not cefazolin that you're going to be giving piggyback, then it's fine. And if it is, you need to call the doctor immediately, right?
I've seen where, on the client summary, they have, client stated or patient stated they have penicillin sensitivity or allergy, but
Okay.
they still give them anyway.
Oh, do they?
Yeah.
Okay. Well, it's not really an adverse effect to have a rash. That's the side effect that maybe can be expected. Just like nausea, vomiting, that's not an adverse effect. That's a side effect. So it's not going to kill you well, it might. But if you're vomiting, you're not going to just pass out and die. Chances are. So, it's okay. I did my assessment on my patient. I've determined that they have fluid in their lungs because they have pneumonia. What I'm going to do next, I've already checked that they have no allergies to this medication that they're getting. And then I'm going to... Sorry. I'm silly. I checked their labs. Okay. So let's begin with setting everything up. So this is going to be my TKO. This is my primary, right? Okay. So I come in, make sure that they have, I don't know how this nurse is doing this, but one time the patient didn't have a pump. He was just getting attached, and it was just, I'm like, yeah, how do you control the rate?
It's
Like
like
what?
just a
Like
bolus.
So,
gravity?
yeah, I mean, I guess it was a bolus, but the patient didn't need a bolus. He was just chilling with it, like, you know, going and going in.
They just hung
I
it?
saw that in the
Yeah.
ER.
Huh?
USC River Hills, they were doing it in the ER.
That's if the patient needs a bolus of like albumin or
Fluids,
something.
yeah.
And
But
they were,
this
like,
guy
bleeding
was,
a lot.
yes, because it is going, when you get a bolus, like, come on, you better,
See, for rhabdomyolysis, they do that.
what, you the, that's true. He might have had it. For rhabdo, you do need a lot of fluids. However, if the patient is just normal and you see that, always question it. 'Cause that's a little weird. Okay. So I'm hanging my primary line just for right now, I mean my primary bag just for right now, just to have it up there. But when I take out my tubing, actually I don't have a new one, sorry guys. You don't know yet. So I take it out, everything's out, right? What's the first thing I'm gonna do?
Figure out which end is just
Clamp it all. Open and close.
Clamp?
Yeah, clamp it. It doesn't come clamped, ever. So that's a rookie mistake.
I did that before. I made a mess all over the floor.
For me all the time.
It's okay though, but it happens because you're just so like, as a student, you're so task oriented. So I think some of these things you just kind of like, it's over your head. So I just hung that to chill, but I'm actually gonna get ready to spike this bag. This will also have, it's not supposed to be attached. This will have a blue clamp at the bottom. That you can kind of release a little bit. I don't know if this will come off. So there's a blue cap at the bottom of this. Yeah, you should make sure. Thank you. You open it just like a little bit, just so that when you prime your bag, your line, you see that the fluid's actually coming out. Because if this is really tight, you can't tell if the line is actually primed. So it's always awkward at first, holding it, you know, but you can do it like this, making sure that nothing touches. Go ahead and lift that off. And of course, take this off second. That's how I like to do it. This first, that second. And put it just like this. Push and twist. Right? Things coming out. Hang it. Go ahead and straighten out your line. And before you unclamp anything, what should you do? Does anybody know? Squeeze it. Drip chamber, how full? Half. Half is fine. Not anymore because when it starts priming, I can't tell if it, you know, what's going on if it's all the way up there. So some nurses use like the bag that the IV tubing came in. You can just hold it right there and prime, or you can just find, you know, a local trash can and do it there. That one.
Yeah, she has it over.
And since this tubing is kind of old, yeah.
What about that other blue one down at that part?
Yeah, this one's, yeah, so that's another thing. What Joy's doing is removing air from the line, which you'll have to do as a nurse. Yeah, see now it's priming.
Oh yeah, there it is.
All she did was
It's
remove
dripping.
the air, by the way. Ooh, you're right, it's going up. Just as long as you see no bubbles, go ahead and put that back. Okay, for me personally, I just like to set the primary up right away, right? So I'm turning this on. And by the way, make sure your key is far enough up so that you can insert it.
Well, that's what you call it.
The key?
Uh-huh.
Like the clamp. No, it's
That always reminds me of clip-ins. Have you ever had those?
So this, when you get to the floor, it's gonna say what floor it is, okay? And then if this is a normal saline, typically what you're gonna wanna put in, which you guys might already know, is IV. And then you need to choose the right normal saline, because there's 40.45 and then there's 0.09. So make sure it's just whatever you're giving and it's not any add-ins either, because some medications even have potassium in them as well. So in this case, we choose, 0.9 IV, 0.9, select it, push OK. And this just says basic because it's NRL, but I am setting up my primary bag. Okay. Since this is a TKO, what should I set the rate at?
10.
Okay, I could do 10. Well, for one, it is mLs per hour that we're running it. Then I'm gonna set my rate at 10. Then my volume to be infused. I told the first group that this is not a full 250, obviously, but if you prefer that everything goes through and that you don't have to keep being run back because there's actually still fluid inside of this bag, then I would set this at maybe either 250 mLs or 260. And my rationale behind that is that this machine is kind of, it doesn't really know that there's still fluids in there. So you could potentially be running back, it's beeping, the patient will let you know. And there's still like some normal saline just chilling there. If you want, you can keep coming in the patient's room and adding 10 mLs and telling it to run. And coming back until it's completely infused. Or you can just bump it up like an extra 10 to 20. And you can let them know this competency because this is like a nursing call. It's for my convenience. I'm just gonna set this at a rate of like 260 or 270 and have it like that, right? Because the only thing you're not changing is a prescribed rate, right? Do you guys, am I moving too fast for you guys? A prescribed rate you don't change because the doctor wanted it to go that fast. For this, you can kind of just gauge it yourself. I'd say the volume to be infused, I'm gonna go ahead and say 260. That's just 268, that's fine too. And then, at this point, does everybody see the screen? This says program secondary, right? So I'm gonna start preparing my secondary. Put this up here, and then you're gonna go ahead and get your, my antibiotic, and my secondary tubing. Once again, I open it up, make sure that everything's clamped, which it is, can't pre-clamp for me. And I'm gonna pop that off and I'm gonna spike. Just like this. Okay, perfect. And then I'll hang this right here. And then what I'm gonna do, what I'm gonna wanna go ahead and do is actually get a new alcohol swab. And because this has been chilling here for even, say it's been like 3 minutes, I just want to make sure that when I attach this to what's been sitting here that it's clean. So scrub this above the pump. It should always be above the pump for 20 seconds. And then I'm going to go ahead and attach. What's my next step? Okay. For back priming, just hold it low like this. Oops. Well, I should probably attach the right one first. I'm like, oh no. They're gonna be running.
Do you lower that bag now or after you bag prime?
Okay, yeah, you can lower it now actually. So the secondary bag comes with this, not the primary. So as Shasine was saying, you're gonna lower this only because by gravity, I need this one to pull first. Lowering the second one. It's not. I lower this one, right? And there goes that annoying noise. I'm just gonna push to shut it off. This one's lower because by gravity, I want this one to first, and then this one as a flush, right? So now it's ready to back prime. Okay. Once again, drip chamber halfway full. I might have this too high actually. The tubing might just be bad. I don't think it's going anywhere. The tubing's bad. Has anyone seen back prime?
Yeah,
Mhm.
it
It
goes
looks
straight
like
in.
it just goes straight in.
What if you just hold
Try
it a
to-
little
yeah.
higher? Just
Try to get this bag up.
Get the primary.
Up all the way. Wait, what?
Get that up. Get
Raise
that
the
down.
primary.
Raise the primary a little bit.
Oh,
There you go.
And I just wait for all the bubbles to go out. See how it's going all the way up and then you can't even tell. Just a little bit to get your line. And if this is new, then it shouldn't really have bubbles to begin with, right? It should only have a few and you're making sure those are out. Because if you air bolus a patient, they can die from it. Not to scare you,
You go
but
to
it's
Orange
true.
is you haven't watched Orange is the New Black, huh?
But also the machine will ring you if there's air in the line. It'll say, have you guys seen air in tube?
Yeah.
So then you do what Joy did, and you just grab an empty syringe and you pull the air out. And if it's still saying that, maybe investigate. Maybe the tubing is old. How long is tubing primary tubing? 72. So that should be one of your first assessments, really. If the patient already has is checking the date, and also dating yourself if you just changed it, right? Okay. So now I am going to program my secondary. This patient is getting cefazolin. You're going to push CE. It's going to pop up. Okay. This is the secondary bag. Moda's ml. Let's see, they're getting it for 25 milliliters per hour. Volume to be infused. I can bump this up again to 60, 70, just to make sure the patient gets all of the medication. I'm going to say 60. Okay. All right. So everything is ready to go at this point. You just have to connect this IV back to the patient. Okay, or if it's already on there, then that's fine. But stop at this screen, because once you attach it, you're going to clean the port and go ahead and attach it to your patient. You don't want the medication you've already started running it, and you're running to attach it to the patient. You want to make sure it's already connected, then try to run it, make sure your drips are falling, and then go. Okay, so do it in that order. So I come to this patient at this point, and of course I clean off the port for 20 seconds. Do that little piece. This is where this is supposed to go here. I clean for my 20 seconds. Then I go ahead and attach this. Mind you, that blue cap is still there, so go ahead and pop that off and throw it away now. Right? Here's my line back, make sure it's not touching the floor. And then I can say run. It's going to ask you, are there drips? Well, what did I mess up on?
Outside clamp.
The clamps.
That clamp was closed.
All clamps open, yes. And the very last clamp that should be open is what?
The one that's closest to
Near
the.
patient. Always. That's how it's going to run, right? It's going to say, is there a drip going into for secondary? You can give it a little help if you've been there for like over 10 minutes and you still see nothing. But it should start dripping on its own. Worst case scenario is that you don't unplug, you don't unclamp this, and the patient didn't get the medication at all, and you've just been running it the whole time. Or that the nurse really didn't see the first drop, and they just ran off. So always first wait for your first drop. You're going to say yes, and then your secondary is going to start infusing at 25 milliliters per hour.
So is the secondary gonna come with an order of specific,
The rate?
Yeah.
Mhm.
Okay.
The rate is going to be prescribed. You're not changing the rate, like I say. You can change the volume to be infused, because you don't want your machine to ring you back. You want the patient to get all the medication. You literally want it to look like it's flattened, and then you want this one to run next. You don't want antibiotic, because some nurses will just be like, okay, they got majority of it, but really, if they have that high of a white blood cell count, they should be getting the whole thing. They shouldn't be just getting however much, now it's time to take it off. I can go. I can take this off. Because it really doesn't hurt you to give the patient all the medication. They're paying for it. They're in the hospital. So don't cheat yourself. Don't cheat your patient. Make sure that you have this completely sandwiched flat. This will run. And then if the doctor wants to continue fluids, you may have 1,000 ml that you start running, or you just may